and welcome to our faculty roundtable today, where I have the very distinct pleasure of introducing our Dean, Mary McKay, who will be leading this discussion about one of the tracks in our mental health concentration, the integrated concentration. So with that, I'm going to go ahead and turn it to Dean McKay. This is meant to be a very, open, informal conversation. I see some familiar faces who have been on the other roundtables earlier this week. So you know the drill, ask questions, but I'm going to leave it to Dean McKay to get us started.
Great. Thank you, Sarah. Well, good afternoon, everybody. And I was really hoping actually that our group would be a little bit on the small side, because I'd love to interact with you. Like, I'd like to figure out what beautiful place is Tracy in right now, because you have this blue sky in back of you, and it looks like, someplace that I would love to be. So I am happy to talk to you from my dean's hat. And you've heard me a little bit if you've been on different kind of webinars with me. But I'm going to talk to you first as a faculty member, because this is an area that I actually teach in, and I'm passionate about integrated kind of physical and behavioral health care, because I think this is the way of the future in order to get our kind of comprehensive needs met. So let me tell you a little bit about kind of my background. And you've heard me talk from kind of the dean's perspective, but let me talk about my practice background first. And so recall that I'm a social worker by discipline, and spent years really in practice settings, a whole range of them, either delivering mental health services or supervising programs that were meant to support kids' mental health. And by extension, those of us that really care about children's wellness has to really care about the adults that are raising those kids. And so it is that kind of perspective that I come from, is how do we think about providing comprehensive supports to help children and the adults that are raising them be both physically healthy, but also emotionally well, spiritually connected, really at the whole of the person. How is it that I can help people to thrive? And that's integrated health, right? So I will tell you that our profession of social work and then public health and policy and followed that, we made a tragic mistake, which is that we started to kind of take apart a whole person, and we talked about their physical health and their body. And then in kind of Western medicine, we also took apart body parts and got lots of specialists around focusing in on particular ailments and illnesses and disease. And there's been incredible medical advances. So I don't want to diminish that work, except that we forgot that your physical health is connected to your emotional well-being and your level of stress. And we forgot that real people are connected to spiritual beings and, really need circles of support to be well. And so I see integrated health as both the way of the future, but also to make up to for some of our past mistakes. And so that's what's really exciting to me. And so I'll share a couple of slides to kind of let you know how this fits together at the Brown School. And then I'll talk about the course that I teach, and then answer any questions that you want around the field of integrated health. Does that sound good, Sarah? Am I doing what I'm supposed to be doing? Okay. All right, so let me share my screen, and I just have a couple of slides. Thanks to our team. There. And so, Eliana, are you good? You can see my screen?
Yeah.
Perfect. So this is one of the multiple tracks that you can choose within the Brown School Mental Health concentration, which is a very popular kind of concentration. Recall, concentrations are that second year if you're a 2-year MSW student, and there's lots of opportunities for public health and social policy to also participate in some of the coursework. So within our mental health concentration, there are these 4 tracks one that focuses in on clinical service delivery, clinical social work, one that really focuses in on particularly substance use treatment. The third is children. So easily I could teach within child behavioral health. And the fourth track is integrated behavioral health. And that's what we're going to talk about kind of today. So primarily how you think about, well, how do I choose the different tracks? You want to think about in integrated behavioral health, setting actually really matters. That many times the most innovative work that is happening in integrated physical and behavioral health is happening in physical healthcare settings, primary care settings. If you're familiar with federally qualified health systems, those are the kind of safety net systems across the country. We have a large number of FQHCs here in St. Louis that provide for your physical health needs for children, for adults, for older adults, but also have behavioral healthcare specialists on site, pushed in to the primary care services. And so often integrated behavioral health care happens in the setting of least stigma and most access, right? And so why is that physical healthcare? Because we have stigmatized behavioral healthcare so much that there is oftentimes real serious perceptual barriers and then concrete barriers that stand in the way of meeting your emotional or mental health needs. And in integrated healthcare settings, those are lowered. People come for wellness checks, people come to treat an ailment, and they also are able to be screened and offered more comprehensive services. So these are what they would call secondary settings for us, but ones that actually I love to work within. So if you're going to take advantage of the integrated behavioral healthcare track, you're going to think about kind of a theory course, a policy course, and a set of practice methods. And the one that I actually teach, Sarah, you probably know this, is intervention and services in integrated behavioral health settings. And I'm really excited about that course. So with that, let me tell you the kinds of things that we'll talk about in the course. And I bring in a ton of guest speakers, from practice settings, so that it's not just me lecturing, but that we really actually talk to practitioners for how this all works. So what are some of the practice models you learn in my course? Crisis theory and intervention, incredibly important. Brief evidence-based practices to help engage our clients, whether they be kids, adolescents, adults, into other types of behavioral health services that are really needed. I'm known, if you look me up on Google, you'll see that I'm known for these things called evidence-based engagement interventions. What are those engagement interventions? It's actually an approach that practitioners can take that grounds referrals into the referrals to other types of services into the felt needs and wishes and preferences of your client. Why is that important? Because many times as linkages, as we've made referrals, we have forgot to ask deeply, are you interested in these? How do you feel about making these connections? And let's talk through some of the concerns that you may have that would actually stand in your way. And so it's really fundamentally, how are you grounding services in the lived experiences and the wishes and the preference of the clients that you're trying to serve? What are some of the other integrated practice models that you'll learn? There's a model that has a lot of evidence behind it called wellness self-management. That if you're managing a chronic illness, let's say diabetes, very common, heart disease, very common, many times you're simultaneously managing anxiety, depression, lots of stress. And so wellness self-management is a comprehensive program that doesn't just focus in on your compliance with medication or your compliance with diet, which, by the way, if you have a diabetic in your life, you know that that's really challenging. And we come at trying to manage that chronic illness, type 2 diabetes, for example, from this kind of perspective that almost waves our finger at our clients to say, you have to follow this diet, you have to take this medicine. And when they don't comply for very legitimate reasons, people feel shame, they feel stigma, they actually disengage from healthcare. Wellness self-management takes a different approach, which is that particularly for adults, but also with adolescents, you are dealing with people that are capable of making rational choices about their own health and their own healthcare. And so all of the discussion around diet, around exercise, around medication and how that fits in your life has to be fit in by your client. And so healthcare often gives you a prescription, tells you the time, tells you what to do. And then we're shocked that there's a gap between the prescription and people's actual behavior. If you've ever tried to manage any issue related to your physical health, you know it is completely dependent on what is also going on in your life. If you have support, if there's calmness, if there's partnership with people, your loved ones, it is much easier to make a change in your health. If there's a lot of stress and distress, it is almost impossible, no matter what the consequences of your health. And so what we talk about in this course is how do you help first and foremost sometimes lower stress and strain within your clients, within their family? How do you up the level of support? Many of the kids and families that I work with have very little natural supports. There's been a lot of disruptions. There's been a lot of strain. And so sometimes the best thing I can do for a child or a family's health and well-being is to really work on how can I wrap some additional supports that are based on your wishes and your goals. Part of integrated health is often that we as social workers or public health practitioners, we have some knowledge and part of the equation, but peer navigators, peer coaching, a host of extension of workforce to kind of bring about health and well-being are part of integrated care models. And so, and we talk actually about, we bring in peer navigators and health coaches into the class so that they can also talk about their work and their approach to helping young people, in my case, and families. So that gives you a little bit of taste of the course. My assignments are actually really applied. These are the course that I teach is a practice course. So you will apply a set of models to either a population or a set of individuals that you're working with in your field placement. And those are often very helpful in terms of integrating your learning in the classroom with what's happening in your field placement. So I'll stop there, and I'd love if we could kind of get some conversation going. I do have a question for you, and you can kind of top of mind answer this or take a moment to answer, but why are you interested in integrated health? Because why matters, because it will fuel your passion for taking these courses. It'll fuel your passion for which field placements you decide to actually work in and with which population. So that question I often begin my classes with as well. So I don't know if we want to unmute ourselves. I can't see everybody, and that's probably because your internet is unstable, or you just find my voice soothing, for kind of your afternoon nap. I never kind of know when cameras aren't on. But, the people that I can see, maybe Michael or Tracy, Allison, but also maybe Amalia or Morgan, if you want to kind of take yourself off mute, anybody to kind of say, why do you care about this area? And anything else that you might want to know about integrated health.
Well,
Michael?
okay, for
Yeah.
sure. I'm interested in integrated health because I find like people with like not substance use disorders like typically, but like maybe like eating disorders or like mental health disorders could also have eating disorders, or people disorders could have like
Correct.
low self-esteem or like anxiety or like agoraphobia, different kinds of stuff that kind of like go together, right? And I was like, well, when I've tried to like, in passing, try to like advocate for their like, betterment or like do so, like interfere in their life pretty much, right? I find like um other blockers come just like, they'll get too anxious about something or react negative or show symptoms of like maybe like, I don't know, OCD about something. And so that's
Right.
why I was more interested in this and because it's like I get that mental health is, one of the mainstays is important and that's really popular nowadays, but it's like everything affects mental health and mental health affects everything.
Correct. And that's actually that bi-directional kind of notion, that your physical health affects your mental health, your emotional well-being affects your physical health is incredibly important. It also, as you as a practitioner, Michael, have to make some tough choices. So for example, in substance abuse treatment, many times those behaviors are meant to medicate or meant to address a serious mental health issue, right? And so you're not going to get rid of the substance use or cut it down without also really thinking hard about how is it that you address the underlying anxiety, depression, because people, again, it's centered in that people are making some level of choice to feel better. And they may not be making the choice that is perhaps in their best interest, or they may make a choice that is undermining their actual physical health or their well-being or their relationships, but they're trying to manage. And so integrated health has you really try to kind of both assess in a comprehensive way what is going on with this whole person, but also look for different, non-traditional, underlying causes that may be missed if that person simply goes to substance abuse treatment and doesn't actually look for underlying physical causes or emotional well-being causes. And so that's what I find really interesting about integrated health, and the exact examples that you just offered. I can hardly wait for you to bring those into my class, because those are the issues that we'll be struggling with. Yeah. Thanks for starting us off. Other folks want to ask a question or tell me why you're integrated, why you're interested in integrated health?
I can go next.
Please, Lauren.
So mine is very similar to Michael's. My undergraduate, I studied kinesiology and was very interested in the health aspect, the physical health aspect of human wellness. And the more that I studied and did different research projects on like heart health and human behaviors, it was quite astounding to see that the way that people were treated, like the application of research varied, from when you're taking it in the lab to the actual human person. And so I was really interested in a more holistic approach to health and well-being, and that includes mental health and, like you said, the support system behind the human person, because something can work in the lab, and then once you, like you said, there's such a great barrier between the actual application of the research and human well-being in their life, because they have thousands of factors that influence.
Correct. And so Lauren, your example, excuse me, is a really good one. Think about yourself as a tool or a bridge to closes the gap between a set of things that would help that person improve their actual physical health or their emotional well-being and where they're at today, right? And so in more traditional healthcare, you would, for example, tell a human that they need to exercise more. Is anybody on this call right now exercising to the level that they actually think that would improve their well-being? Many of us are not, right? There's a gap between what you know or what you're prescribed or the knowledge base and what you're able to pull off in your life. And so Lauren, you become a bridge and a tool to help, in the example I'll use now, an adult figure out what would help you further your exercise regime, right? Without a lot of judgment, that you're not going to go from 0 to exercising 6 days a week, right? And so you're really trying to take incremental steps. And this goes to Michael's position as well. Harm reduction, as opposed to discontinuing use of substances, often falls in integrated health. And so you're thinking about yourself as a practitioner. How are you helping people along their health journey? Identifying barriers and helping them come up for solutions to those barriers, right? The other thing that Lauren, what we never do in science, which is the thing I think you talk about the lab, is we never look at what's good enough. We're always looking at like, here's the protocol, and if you follow this protocol, you get this outcome in the lab. There's very few studies that say, but if I did half of it, would I also see a substantial improvement in either my emotional well-being or my physical well-being? So there are some real limitations to that literature. So you have to humbly, let me just talk about application of evidence-based practice for a minute, because this is really important, not only for this track, but across mental health and across our tracks. There are some real limitations to evidence-based practice. What are some of them? One of them is just, how those studies were set up. It was either all or nothing. Right. And that isn't actually how most human beings work. We're mostly like works in progress. The second thing is most of those trials do not include big proportions of underrepresented people, right? Your health outcomes often are predicted by your identity, your racial identity, your sexual orientation, your proximity to resources, your geography. There's a big disproportionate burden on some sets of populations. They have more barriers, and the science hasn't been created for them. And so we have to be humble about, here's some of the evidence-based practices that we know, but we also have to be really capable in this program of taking apart those studies and really humbly applying them, or being suspicious about applying them to the populations that you care about. And that's going to be a big part of this program. Is you're going to be exposed to a lot, but we're going to try to build the skills so that if you identify a population that you really care about, you're going to be careful about what you're going to apply and what you're going to really, really partner with the population, because some of these evidence-based practices need serious adaptation, cultural adaptation, contextual adaptation, worldview adaptation. And so you'll get both. Some of the best science, but also some ability to really critique those science, because your clients need you to do that. Yeah. Other things that you wanted to hear about, I do think this track is one of the unique features of our school. And there are a few other schools that also have an integrated track, but we're on the leading edge of this in a lot of ways. So I'm happy to field some questions about it. Yeah.
Hi, Dean McKay. So my name is Tracy. To answer your question from before, I'm in Florida right now, so that's why it's pretty sunny.
It's beautiful. We're all wishing we were kind of there, I think.
Oh, okay. Yeah, it's been nice lately. So I'm coming in as a dual degree student, the public health and the social work. And right now, with where my interests lie, I'm interested in working with African American populations in the area of substance abuse.
Good.
So like this past year that I've been out of school, I've been a guardian ad litem. And something that I've realized, at least with the case that I've had, is that the parents that I'm working with, they keep on cycling through different systems of care. So right. I see the parents cycle from jail to like the rehab centers to different clinics, and then it repeats again and again and again. So that's one of the reasons why I'm interested in working in the area of integrated behavioral health, because I want to learn more about how to disrupt some of these cycles that keep occurring, so that it also doesn't impact the child itself, because the child is the one that's growing up in these homes. And I know that they're exposed to this trauma that could impact them negatively as they grow up. So I don't really know what population I want to work with, whether it's the adults or the children, but I know that both are so related and they impact each other. So that's what I'm hoping to be able to do.
No, that's amazing experience. so I need to unpack, because you said, Tracy, so much that we would tackle in this course, and then also across the programs of social work and public health. So the first thing that I have to say, and kind of just as plain a way as I could say, is that if you have a substance abuse disorder, that is no joke, and it is not easy to address that set of issues. So one of the things that we would like in substance use treatment is to flip a switch, that you are motivated to give up substances and you do so. But in reality, a substance abuse disorder is about, your mind and about your physical addiction of your body. And we who don't have, if you don't have a lot of experience in substance abuse, also think that like your first time in treatment is going to do the trick. This is really complicated, and relapse is often a part of the journey. And people, if you've multiply relapsed, people feel ashamed about that. When in reality, there's a very clear disease cycle underneath this that is no joke to address. And so instead of shaming people, to explain to them that addressing these dependence on substance use is really complicated. Forecasting relapse and how you plan for that, and really supporting people on their journey, incredibly important. That's the first thing you said. The second thing is you talked about the trauma of the child, but substance abuse in adults is often related to very serious trauma exposure. So there's a study that many of you probably have heard about the Adverse Childhood Experiences study, where what happens to you as a kid shows up in your adult health. And so even though I'm so glad that you care about the kids and the trauma that they are experiencing, when you reframe what their caregivers are experiencing and go back into their history, they often have experienced significant abuse, exposure to real serious traumatic events, and your substance abuse is really explicitly often linked with other trauma exposures. So peeling those experiences away, elevating them, and trying to address them as some of the core drivers of substance abuse, really all a part of integrated health. And so in my course, we spend a couple of weeks talking about trauma-informed care. So let me go to your third area of interest, which is you want to work with African-American populations. If you think about the burden of structural racism, the exposure to both micro as well as serious egregious events, even the context that we are in currently around the stress and the distress about watching people die, Black people die at the hands of police, those traumas. And there's a disproportionate burden of trauma exposure, often with people of color and other marginalized identities. You go at this with universal understanding that bad things often have happened to the populations that you care about. They are not bad people, but negative, bad things can be the burden and the trigger for some of your behavioral health needs and some of your physical health needs. And so integrated care is complicated. So are humans. And so why I appreciate these approaches is because why you see those cycling is because we've set up discrete systems that haven't put the whole person all together, but also have sometimes taken a more punishing approach as opposed to a helpful approach. And that's what we're also trying to kind of, so the last thing I'll say about my course is we spend a lot of time around delivery of practice and different models, but we spend a few weeks actually talking about dismantling the systems that we have set up. Because the systems that we have set up only serve a very relatively small portion of people that we want to serve. And the experience, Tracy, that you've had with the families that you're watching cycle in and out, those systems haven't been set up for them. And so it is this next generation of integrated approaches where we need to set up different systems that are more grounded in the lives of the people that we care about. So it's not just people that we're trying to change, but also the systems that we have set up, because they are deeply, deeply flawed. And so I'm happy to talk about that some if you're interested, but we'll spend some time with that in our course. Other things, particularly a couple of you can't participate, but if you have a chat that you want to ask, Sarah will help you watch the chat as well.
I have a question based off of your
Yeah,
last
please.
comment with Tracy. Because I'm interested in that too, the implementation of integrated behavioral like practices in different institutions, like I guess
Yeah.
like the foster care system, not only foster care system, but like adolescent housing. There was a story,
Correct.
I don't know about recently, but like, different like suppression holds they use on people, and they end up dying, and it's
Correct.
really, really tragic and stuff like that. So could you talk more about like that implementation, and also maybe program evaluation of those places, if we would be
Mhm.
doing that?
Yeah, so you said a lot, and so some of you might get some of what you're talking about in kind of the integrated track, and then Michael, other content are going to be found in other courses. So let me go to kind of work with adolescents and these holds and kind of the physicality of trying to help kids, be behaviorally successful, which, by the way, we never talk about kids' behavioral success. We talk about punishment, we talk about consequences, right? But in reality, if you're going to pull for kids' natural resources, even adolescents that have some behavioral control issues, you have to be thinking about their success and their strengths and build on those. So there's plenty of evidence that there are de-escalation techniques that could actually, and approaches that could actually kind of get rid of the lion's share of all these holds that we place in adolescent residential care. Same thing with other kind of incarcerated populations as well. There's a ton of evidence that there are alternatives to the way these systems operate, and then there's a ton of organizations that choose to actually ignore that evidence and continue with business as usual. So you have to, in school, learn those alternatives and apply them into any practice setting that you're in. Sometimes you're going to run into lots of barriers and resistance, but that's the Brown School is about preparing you for best practices and also trying to help you as you go into organizations that really need change. Do you have the skills to be an internal change agent? Or some of you will decide that I love kids and families, but the best way that I could actually help them is to actually reform the systems that they're in. And so I'm going to go into policy. I'm going to go into leadership and management. So how you enter this program and how you leave this program sometimes is predictable by you, and sometimes really is quite transformative. And so I think, Michael, there's a ton of things that you're going to learn that will be outside the norm, but that you'll want to actually apply. In terms of foster care, there's a trauma-informed approach to kids that have been removed from their family, adolescents who can't return to their family, that understands that much of what drives these situations is trauma, and some very hard things have happened to kids and their families that raise them. And so when you take that approach, you're also adopting a kind of a healing stance and of understanding that even when very hard things have occurred, it's possible for people to heal and course correct. You may get some of that in the integrated track, but there also is a kind of a concentration around injury and violence prevention that does a lot more work around foster care, around trauma, around domestic violence. And even if you don't concentrate in that, you probably want to take a course or two in that area, because that's where it overlaps. And Morgan has kind of a similar question about how easy and hard is it to cross over between concentrations and their specific courses. So Morgan, the challenge has to do with your capacity, your time with us, and not the barriers in the program, right? And so you will find that that one of the strengths of the Brown School is you have, this expanded set of concentrations, this expanded set of specializations, and you're one human being that's going to have a couple years with us. And actually you'll find that the courses are pretty rigorous. So if you take too many courses, in the words of a behavioral health specialist, you will lose your mind because it's too much, right? So you're going to have to make tough choices. We don't create a lot of barriers. So certainly you could kind of sample from some of the courses in other concentrations as you pick a concentration. But if you pick a concentration and a specialization that has requirements, then some of your choices are more limited. And so it gets really complicated because there's tremendous choices. There's great faculty. There's things you want to learn, and you've got a couple of years with us at the most. Tracy has 3 if she's a dual degree student, right? But you'll find that goes by really quick. And so the obstacles aren't necessarily in the program. It's kind of how ambitious you want to be without completely tiring yourself out, and how you want to put together some of these combinations. So those are really up to you. And so just like I suggested to Michael, you may want to pick the integrated track in the mental health concentration because you're so interested in substance use. But violence plays a pretty big role. And so you might want to fill in with a couple of the courses from one of the other concentrations. And you'll have an advisor that will talk you through all this. And our assistant and associate deans will help you get there. The other thing is those of you that are not advanced standing, because that's a very quick route in and out of our program, you'll have at least the first year to sort out some of your interests because you'll be in the required curriculum. And that sometimes is a surprise for our students. I'll be honest, I come from a clinical direct practice background. I ended up in policy and system reform in my career. Why was that? Because I thought that programs did terrific work with kids and families, but they just kept coming. And I cared a lot about the kids of color, the families of color, the folks that were really impacted by poverty and trauma exposure, that I needed to get to them earlier. And mostly I needed the world to treat them better. And then when they did get into systems, it had to be aligned with what they really wished, and they had to be in charge of their treatment. So some of what you'll learn in that first year curriculum will surprise you, because it may be that you're thinking you're going to go into direct practice and you discover community organizing and prevention and policy change. And you decide, you know what, I can help kids and families from many different avenues. And so, you know, be open as you kind of go through especially the initial semesters in our program. Any other things? Sarah, you've heard these conversations before as well. Are there particular things that you think it would be important that I say that I didn't say?
I think a lot of what you've shared has been really in line with what we've talked about. The one thing that I think you really just like, it really blended beautifully, but with other sessions that we know that there are a lot of options at the Brown School, and we have students who are passionate about many, many things. And it's hard to pick just one thing. But the important piece there is to know that your time at the Brown School is, you know, a quick time, you're gonna have your whole career to explore other interests. And one of the things that was discussed in another session was professional development opportunities and ways to expand your knowledge while keeping yourself grounded in the concentration or specialization areas that you choose to. So, and I know that, I'm not sure if you, Dean McKay, have taught any of the professional development, or no, of course, you know folks who do, but do you want to speak to that a little bit?
Yeah, so I think that there's a couple of things, Sarah, that you said that it's important that I kind of highlight. The first is that you're preparing to launch the next step in your career, not learn everything about everybody, about everything that you can possibly learn. And so I think that's really important. And that also our professional development options where you can get advanced certificates post your master's degree are really, really important. You should check out, if you haven't, our professional development series. There's a lot of free options on there, low cost options on there, and also a set of certificates that many of our alums come back. Because of this experience with the pandemic, we are much more nimble virtually. I'm really proud of open classrooms, professional development, because you could go and look at, you know, what is now, I think, over 100 offerings. And Sarah put the link in there. So you can see some of the faculty that you're interested in studying with actually be on open classrooms and see how they actually do. So I would definitely check that out. Open classrooms came out of a real need within our community to kind of lower the walls and up the supports that the Brown School could provide to our alums, but also our community of practitioners in the St. Louis region. So I'm particularly proud of that. So be a lifelong learner. Think about this next graduate program as your next steps in what you're learning. So you're going to bring in all that experience from being in the guardian ad litem's office. You're going to learn some new things to go out and help kids and their families, but you're going to keep learning. I think that's the other piece about what the Brown School education really does kind of stand for, is we're going to try to give you the tools to critique what you're learning. So we'll talk to you about evidence-based practices, but we'll also beat them up. We'll ask questions about why they've been applied in this way. And I think that's really, really important for those of us that care about those that haven't been, that have been marginalized, pushed to the edges, that you not just apply those practices, but you are part of the solution to figure out, do they even apply at all? And so I think that's a unique, you know, feature of our school. But check out open classrooms, professional development, because once you're an alum of the Brown School, we stay in pretty close contact with you. And you'll be tired when you graduate, which is, I'm about ready to congratulate our next set of graduates. So you'll say, oh no, I'm done with learning for a little while. That will be normal, because graduate school is pretty rigorous. But I find that our graduates really stay in good touch with us. So anything else that you want me to kind of comment on before we wish each other a good afternoon? Another lingering question?
I have one more quick question.
Please.
So I'm curious, like with the work that you've been doing, like you keep talking about evidence-based practices and how we're supposed to like critique them, especially if they've been around for a long time. So with these systems of care that you've worked with, how responsive are they to like this change and like going from what you've always done to, it's like, oh, I'm coming in now with an idea of what evidence-based practice is supposed to look like, but are they always responsive to, I guess, those thoughts that you might have?
No, which is the problem. So I mean, the reality is that once you set up an institution, you also set up a set of processes and policies and procedures that replicate the outcomes that you are getting. Institutions are stable, right? Even well-intended social service agencies, behavioral healthcare systems. So part of what your graduate education has to be is a set of skills and tools for how you organize change inside an institution and how you insist on change as an advocate outside institutions, right? Systems, even well-intentioned systems, don't change without internal change agents and leadership, and they do not change without outside pressure. Why? Because it's too complicated. It's too complicated. Our systems are overrun with people that often do that revolving door thing that you described, but they're busy, right? And so you really want to come away with a set of, you know, change agent skills for internal advocacy as well as external pressure. I think that's really important. Where you ultimately kind of find your career will be up to you. I don't worry that that the systems that I've worked in have been not so excited about change. That's not my concern. My concern, for example, is how do we get better outcomes for the children that you're designed to serve, right? And so we provide a set of supports. For example, I'm also known for these things called learning communities, where we'll organize people across agencies to learn some new things, to come up with implementation plans so that they can change. But also I work a lot at the state level with Medicaid policy to change what we pay for and not. And so it's not only me relying on your goodwill or your interest in improvement, but it's also that you won't get paid for some of the sets of things. So let me give you an example in the child area, because Tracy, I know you're interested in. So kids with behavioral challenges who are not behavioral successful often get referred for mental health services. There is a very clear set of evidence that you must work with families and schools in order for those kids to be behaviorally successful. This individual talk therapy with kids that are really getting suspended from school, although supportive, is not going to result in behavior change. States across this United States pay for individual treatment alone and don't seem to care whether you engage the families or the school systems. So how on earth are you going to get different outcomes for kids if providers are not taught how you collaborate with families? That's actually what I teach Sarah in professional development. Is I teach parenting and family collaboration models, family strengthening models. So you as professionals have to know how to engage and collaborate well with families. But for those of you that don't want to or don't feel the need to, I also need you not to get paid for individual treatment alone, right? I need a whole range of ways to change what happens so that kids can be more behaviorally successful. And so certainly the systems that I've worked with, New York State in particular, were not wild. The provider organization said, what, we can't, nobody has a family. Of course, kids are connected to other adults. Find those adults, help them to get more involved and supportive in their. But so it needs both internal change as well as external pressure. And so it's a tough job. So if I haven't also said one more thing, I need to end with your own well-being and self-care. You cannot be a good integrated health practitioner without having your emotional and physical life intact and a constant kind of focus of your attention. And so because two things, because A, you'll be a better practitioner because you're emotionally and physically well, and B, you'll be humbled by how hard it is, right? That's really important, that humbleness about making time to be the best practitioner and the best human being that you can, having the courage to address your own mental health issues, having the courage to really push pause when you find yourself kind of at wit's end or eating poorly or not exercising at all. And so incredibly important, because what I will tell you about our professions in social work, public health, and policy is many people leave because they're not built for the long term, the long haul. And the long haul is how you actually stay in this work and not get used up by this work. We see that a lot in St. Louis around people that are very, very involved in progressive movements around racial equity. You can get burned out pretty quickly when you don't have the success or get the pushback that is inevitable in this work. And then we lose people. So if you're interested in integrated health, for goodness sakes, apply it to yourself first. Think about how you've managed this pandemic in your own personal life. Where have you fallen down? Where have you succeeded in being able to weather this pretty distressing experience and bring that to your practice? And so hopefully that gives you some tools for how to get ready for graduate school, because you need a pretty robust set of supports here that are going to pick you up when it gets hard, and a pretty significant set of health practices that can kind of get you through both emotionally and physically. So usually people that are interested in integrated health, they're interested in applying those to their own life too. So it's not just for other people, it's for all of us. Sarah, you probably don't know this, but I'm running another 5K on Sunday. So I picked up running again after years off, just to get me through this pandemic experience. So you might have assessed that I'm old in this game, so I've messed up my foot, but it makes me feel wonderful to run, and I'm a little more physically healthy as well. So so I want to just thank you all. I want to say I'm super excited to welcome you to the Brown School. You'll have a lot of contact with me in the fall. I am very proud of how we've managed this public health challenge. I'm really happy with our schedule, and I expect to be interacting more and more with you in person as we start school. And I really feel incredibly grateful to people like Sarah and so many of the staff and faculty at the Brown School that have brought us through this really kind of complicated time together. And now we're returning to a set of experiences where we can be together more, but not forget what we've learned as well. And so with that, I'm going to wish you guys a really, really happy day. I'm accessible. I answer my email. So if you have another lingering question, feel free to write directly to me, write to Sarah, write to your admissions counselor, anybody along the journey. We want to get your questions answered, and I'm looking forward to saying hi in the fall, okay? And Sarah put her email in there.
I did. Thank you so much,
Thank you.
McKay, for your leadership, and thank you for your time today. This is a really wonderful conversation. Thanks all.
I'll remember all of you. So please come look me up in the fall. Thank you.
Thank you.
Bye-bye. Bye.
Bye, thank you.
All right, thanks, Michael.